Chikungunya fever was first discovered in 1952 during an outbreak in the Makonde Plateau, along the border between Tanzania and Mozambique. The name, chikungunya, derives from a word in the Makonde language, meaning, to become contorted, and describes the stooped appearance of sufferers with joint pain, a characteristic symptom of the disease. This discovery was significant in understanding this viral disease, which is transmitted to humans by infected mosquitoes. Chikungunya fever is a viral disease transmitted to humans through the bite of infected Aedes mosquitoes, primarily the Aedes aegypti and Aedes albopictus species. The transmission cycle begins when a female Aedes mosquito bites a person infected with the chikungunya virus. During this blood meal, the mosquito becomes infected with the virus. Once inside the mosquito, the virus undergoes an incubation period, replicating and spreading to the mosquito's salivary glands. When this infected mosquito subsequently bites a human, the virus is transmitted into the human bloodstream through the mosquito's saliva. After entering the human body, the virus incubates for typically 3 to 7 days before the onset of symptoms. The infected individual may experience fever, joint pain, muscle pain, headache, nausea, fatigue, and sometimes a rash. During the viremic phase, when the virus is present in the bloodstream, another mosquito biting the infected individual can pick up the virus, continuing the transmission cycle. Direct person-to-person transmission of chikungunya is not common. However, rare cases of transmission have been noted from a pregnant woman to her fetus, as well as through blood transfusions and organ transplants if the blood or organs are from an infected person. Prevention of chikungunya fever primarily revolves around controlling mosquito populations and avoiding mosquito bites. Measures include the use of mosquito repellents, wearing clothing that covers the skin, and eliminating standing water where mosquitoes breed. These preventive strategies are crucial in areas where the Aedes mosquitoes are prevalent and where outbreaks of chikungunya fever occur. Chikungunya fever infection follows a specific route involving the transmission of the virus through mosquito bites. The cycle of infection begins with a female Aedes mosquito, most commonly Aedes aegypti or Aedes albopictus, biting an individual already infected with the chikungunya virus. During this blood meal, the mosquito becomes infected by picking up the virus. Once the virus is inside the mosquito, it undergoes a period of replication, eventually reaching the mosquito's salivary glands. This period, known as the extrinsic incubation period, is crucial as it makes the mosquito infectious, capable of transmitting the virus to humans. The primary mode of transmission occurs when this infected mosquito bites another human. The chikungunya virus is then transmitted into the person's bloodstream through the mosquito's saliva. Following the bite, the virus incubates within the human body, usually for about 3 to 7 days, before symptoms manifest. These symptoms commonly include high fever and joint pain, along with muscle pain, headache, nausea, fatigue, and sometimes a rash. The transmission cycle can perpetuate when another mosquito bites this newly infected individual during the viremic phase, when the virus is present in the blood. This new mosquito then becomes infected and can transmit the virus to other humans through subsequent bites. Direct person-to-person transmission of chikungunya is not typical. The virus predominantly requires a mosquito vector for its life cycle and spread. Therefore, prevention efforts are focused on controlling mosquito populations and preventing mosquito bites. This includes measures such as using mosquito repellents, wearing protective clothing to minimize skin exposure, and eliminating potential mosquito breeding sites, such as areas with standing water. These preventive strategies are especially important in regions where Aedes mosquitoes are prevalent and chikungunya outbreaks occur. Chikungunya fever, a viral illness spread through mosquito bites, primarily requires supportive care for treatment, as there is no specific antiviral medication available. The focus of the treatment is on relieving the symptoms of the illness. Pain relief and fever reduction are crucial aspects of managing chikungunya. Over-the-counter medications such as acetaminophen, Tylenol, or ibuprofen, Advil, Motrin, are commonly used to alleviate joint pain, muscle pain, and reduce fever. It's important to avoid aspirin or non-steroidal anti-inflammatory drugs, NSAIDs, until dengue fever, which presents with similar symptoms, is ruled out to avoid the risk of bleeding. Rest is another essential component of the treatment. The body requires energy to combat the viral infection, and adequate rest is key to strengthening the immune response. Alongside rest, staying well hydrated is vital, especially if fever is present. Drinking sufficient fluids aids in maintaining hydration and supports the recovery process. For individuals experiencing severe joint pain, additional measures might be recommended. These can include applying cold compresses to the joints, engaging in gentle exercises, or undergoing physical therapy to reduce discomfort and improve joint mobility. Nutritional support through a balanced diet enriched with fruits, vegetables, and proteins can bolster the immune system and facilitate faster recovery. Patients with chikungunya fever are also advised to prevent further mosquito bites, especially during the first week of illness, to avoid spreading the virus. This can be achieved using mosquito repellents, bed nets, and staying in areas that are screened or air-conditioned. In some cases, particularly for vulnerable groups like the elderly, young children, or individuals with chronic diseases, more careful medical monitoring may be necessary. Additionally, some people opt for traditional or home remedies to find relief. While these methods may offer symptomatic comfort, consulting with a healthcare provider before trying them is advisable. For anyone suspecting they have chikungunya fever, seeking medical attention is important. A healthcare provider can conduct specific tests to confirm the diagnosis and recommend an appropriate treatment plan, as well as rule out other diseases with similar symptom profiles, such as dengue or Zika virus.